Good day, everyone. I'm Brian, moderator for this webinar. Welcome everyone for today's webinar, Avoiding Balance Billing and the Waiving Copays and Deductible Liabilities. I would now like to introduce our presenter for today, Rachel V. Rose. I would now like to hand over the floor to one of the best speaker of healthcare. Over to you, Rachel.
Hello, my name is Rachel Rose, and I'm delighted to be here to present on avoiding balance billing and waiving copays and deductibles liability. The primary focus of my practice is healthcare, cybersecurity, securities law. So today I'm going to begin with definitions that are critical to appreciate what I'm going to delve into later in the presentation, specifically items associated with healthcare billing, coding claims, as well as specific fraud, waste, and abuse laws, nuances that relate to the No Surprises Act, and then importantly, avoiding False Claims Act liability via Stark Law and AKS violations by waiving copays. Then I'll end with some concluding thoughts. So what are some key definitions that everyone needs to know? So this notion of remuneration is not new, and it's certainly not new as it relates to the waiver of copays and deductibles. So what about balance billing? Well, that's equally murky, especially when it comes to government programs. So in September of 2020, there was an article published in an American Bar Association publication that was actually really good. And it related to the notion of surprise billing. And that is the inability of policymakers to address the problem. And this is pre the No Surprises Act. So the ABA article gave a lot of examples, and one example was anesthesia and pathology balance bills exceeding $20,000. So what's a professional courtesy? And this is also equally as important when you bear in mind kickbacks and what may constitute illegal remuneration. With that as the backdrop, let me delve into some of the nuances between the anti-kickback statute and the physician self-referral law, also known as the Stark Law. So professional courtesies and the Stark Law. So if you're wondering where the Stark exceptions are, all Stark exceptions are found at 42 CFR 411.357 in general. Professional courtesy is found under subsection 6. I believe it's important to appreciate the U.S. health insurance industry in terms of billing, coding, and claims, as well as some of its history, because in fact, it does dovetail into the No Surprises Act. So basically, early in the 1900s, during our Teddy Roosevelt era in the White House, which became known as the Progressive Era, under common law, employers were liable for injuries that occurred at their facilities if the employer was negligent. Now, New York was on the forefront and one of the first states to view hospital service plans as the prepayment of hospital services rather than as insurance. But Blue Shield mirrors that of Blue Cross, but it actually, Blue Shield is the medical services plan, which is analogous to the hospital services plan. HMOs evolved over time, and although the first known HMO stems back to 1910 as a clinic located in Washington State, and then later in the Los Angeles area, one entity that you're probably all very familiar with is the Kaiser Group and the Kaiser Foundation. Now, Medicare and Medicaid were signed into law on July 30th of 1965 by President Johnson. past this time, we have Medicare Part C, which is Medicare Advantage, Medicare Part D, which is the prescription drug plan. Well, here we have CHIP being created in 1997 to give health insurance and preventative care to nearly 11 million or 1 in 7 uninsured American children. And then we have the Affordable Care Act, and that became law in the spring of 2010 and brought the health insurance market place. PPOs recently took over HMOs because subscribers to a PPO may see any doctor, physician, or other provider. Point of service is a slight variation on an HMO model. HIPAA requirements, paper claims, there are primarily two types of claim forms. We have CMS 1500 and UBO 4. Coordination of benefits is key. So when a patient has both primary and secondary insurance, the two plans will work together. So the No Surprises Act, it was enacted as part of the Consolidated Appropriations Act. Want to reemphasize surprise billing. It occurs when the patients are unaware that the medical provider treating them is not associated with their insurer, potentially exposing them to fees higher than in-network rate. Now, the No Surprises Act went into effect in January of 2022, but it was passed in December of 2020. So it took over a year to implement. So as I mentioned, the Consolidated Appropriations Act became Public Law 116-260 on December 27th of 2020. So what did the No Surprises Act do? Well, for anyone who lived through COVID, you became very familiar with the Public Health Services Act. So again, the overall tenor of the No Surprises Act is to prohibit balance billing in the case of surprise medical bills. The interim final rule reiterated, so did the final rule, that the No Surprises Act's application to air ambulance services is in there. Now, urgent care centers are not included among the facilities covered for purposes of non-emergency care. So what about the multi-agency interim final rule? It's really interesting when you see so many different agencies coming together on a final rule because it doesn't happen all the time. So the No Surprises Act also amended the FEHBA by adding a new subsection. So some key items, again, were that prohibition against balance billing. Now, emergency services, the NSA's independent resolution process has been a topic of case law. So the IDR process, again, the final rule was issued on August 19th of 2022. Now, the IDR final rule was issued on December 21st. Now, on February 16th of 2024, announced that all currently applicable extensions will end on March 14th of 2024. What about the False Claims Act? For those of you who may not be familiar, it is the federal government's primary fraud enforcement tool for returning monies to the federal fisc. It stems back to 1863. There was, in fact, a False Claims Act settlement. So as we round out the hour, I just wanted to hone in on writing off out-of-network or government program copayments or deductible. In healthcare, there is a regulatory requirement for a compliance program, and there are 7 factors. So review billing and claims processes, work with your EHR vendors, update policies and procedures, and educate every relevant workforce member. And I want to thank you again for your time and attention here today. I've also provided some additional resources for you to make life a little easier. Thank you again.
Thank you, Rachel. That does conclude the session for today. Thank you everyone for participating, and thank you, Rachel, for the wonderful webinar. You all can disconnect now. You all have a great day ahead. Bye bye. Take care.